Hello everyone, I am Clinical Clerk Tristan Victor Rayton Santos RN, and this is my ENT OSCE video. Both the patient and the examiner already washed their hands prior to the conduct of the physical examination. Proper health protocols prescribed by the Department of Health were observed in this video. Both the patient and the examiner wore face masks. First, introduce yourself. Ask for consent and explain the procedure to the patient. It is valuable to establish trust and explain the procedure to the patient. Inspection and palpation of the external ear. Sit at the same level or slightly higher than the patient. Inspect whether left or right ear have equal size and shape, and look for any skin lesion or mass. Check for ear position, whether the top of the ear just touches or hardly crosses the imaginary line drawn from the outer canthus of the ear from the occiput. Palpate the auricle between the thumb and the forefinger. Note for any tenderness or lesion. Palpate the mastoid process using the index and middle fingers. Note for any tenderness. Press the tragus inward and toward the ear canal using the middle and index finger to detect for any tenderness. Inspection of the external auditory canal. Inspect the unaffected ear first. Explain the procedure to the patient. Ask the patient to tip the head slightly toward the opposite shoulder, away from the side being examined. Use the largest speculum the patient's ear can accommodate. With the other hand, straighten the ear canal by pulling the auricle gently upward and backward. Turn on the otoscope light. Grasp the otoscope with the dominant hand. In my case, I am a left-handed person, so I will be using my left hand. For cooperative patients, hold the handle of the otoscope in upright position. For the restless patient, hold the handle of the otoscope against the patient's head to help stabilize the instrument. Then gently insert the otoscope in the external auditory canal carefully, advancing it until the tympanic membrane is seen. Check for cerumen, color, lesions, discharge, or foreign body. To complete the examination of the ear, the patient's hearing should be assessed using the tuning fork and audiometry. Examination of the nose. Explain the procedure to the patient and secure consent. Visually, inspect and palpate the nose for any deformity, symmetry, inflammation, or presence of alar flaring. Evaluate the patency of each nostril by pressing shut one side of the nose and the other and asking the patient to sniff. Inspect the internal nose by tipping the head back, by placing the thumb against the tip of the nose and looking through the nares with the use of the pen light. In our case, we use the otoscope. Note for any septal deviation or perforation. Further inspect the nasal mucosa. Inspect further the inferior and middle turbinate. Examination of the oral cavity. Again, explain the procedure and secure consent from the patient. Inspect the dorsal tongue. Ask the patient to extend tongue and say, "Ah." Note for slight rough texture. Note the symmetry of the tongue and uvula when the tongue is protruded. Inspect the soft palate as the patient says, "Ah." Ask the patient to tilt head back with mouth open and examine with dental mirror. Inspect posterior pharynx and uvula. If the patient finds it difficult to hold the tongue flat, gently depress it with a tongue depressor, being careful not to initiate the gag reflex. Note the appearance of the oral mucosa of the tonsils. As you can see in the video, I don't have a pen light. That's why I used that glasses with the touch light. Inspection of the neck. Again, explain the procedure and secure consent from the patient. Sit facing the patient in the same level of slightly elevated. Ask the patient to hold the neck in normal, relaxed manner and observe for deviations for the trachea. Go to the side of the patient to inspect it laterally. Observe for any deviation in the anterior neck. Ask the patient to extend the neck slightly and swallow water while observing upward symmetrical movement of the trachea. Palpate the lymphatics of the neck and feel for any thyroid masses. After the examination, we thank the patient for her cooperation. In this case, I thank my sister for being my patient in this OSCE video. Thank you and God bless us all.